If I were into teaching of physiotherapy or joined as a physiotherapy academician, there are few things that I would do in terms of helping the students grow in their career. The first thing would be trying to make them understand how a clinician thinks and how to approach the patient as a clinician, and not just by memorizing the textbooks. Not just I understand that theoretical aspect is the basic foundation for you to understand a condition to get into treating patient, but trying to think clinically and clinical reasoning, clinical judgment is very important. I would also teach them how to communicate with the patient, how to interact with the patient, and how to approach the patient. If you are approaching a patient in a certain way, you need to keep things in mind, and that is the communication aspect. But also you need to know the clinical aspect and think critically, clinically, and think as if you are actually dealing with the patient, because with case discussions, with scenarios based, with problems to be solved in the classroom, it gives them more confidence and more positivity for them, and I would feel that it would reduce the stress and the scared when a real patient comes in. I would also encourage them to have over discussions, also treat them in a way where they are in a situation where they are supposed to be observing the seniors, and also get into some kind of habit of asking why a particular treatment has been done for that patient, because blindly following what the senior does, I don't think it makes any sense. I feel it is important for a student to observe, to get into the clinical aspect, get into the field, and also talk to the patient in the wards, in the under the seniors, so that if they are making any mistake, it is easier for them to learn and then come back, ask doubts. If there are any clinicians who get into academics, they know how to approach the patient. So if I have worked in the clinical setup for 4 years, I know how it is as a fresher to come into the clinic or the hospital and interact with the patient, and how scared you are to handle your first patient, and over the period of time, after 100 patients, how confident you would be to handle the patient. So that wisdom or that teaching or that learning that I have, I would give it to the students, because just memorizing or just learning what is there in the textbook or just to pass exam is not that enough. But I also understand how important theory aspects would be, because when I finished my masters, I didn't have that much of confidence in treating a patient, but then my theoretical knowledge and my approach of learning new skills, learning new things, or open-mindedness helped me get into the patient, get into the clinical aspect. But of course, I was very scared. I was not that confident. Theoretical knowledge with clinical knowledge would be a great thing. So it is a lecturer or the person who is teaching the physiotherapy, it is more important for them to try to educate them about that. So all in all, I think that it is about carefully observing, thinking clinically and critically, and also helping the patient move with empathy, because soft skills are also very important. So it's not just the clinical skills. So teaching the students about soft skills, the communication skills are also very important. So this is the change, or this is the kind of work that I would like to do if I am trying to educate my students, if I were or if I was not a clinician. That's a different thing. So I hope you like this video. Subscribe to more. Bye.